Hi, everybody. Welcome, families, friends, and faculty, to the 2014 pinning ceremony of Cohort 5, Class 2014. It's really difficult to believe that this day is finally here, and I'm honored to stand up here with Dean Johnson and other nursing leaders from the George Washington University School of Nursing. When we arrived for orientation 15 long months ago, we were nervous, excited, and overwhelmed. We had no idea what to expect. But we were the grateful recipients of countless survival tips. One of those tips in particular has stayed with me and has resonated with me throughout this entire program. I've told many new and prospective students about it and reminded a couple of my classmates along the way. Let the people in your life know that this is your priority. You will cancel plans, miss events, and sometimes seem like you're not as present. You may change how you react to things, occasionally say things you don't mean, and possibly forget or transform the role you once occupied. You'll be forced to ask for help, a lot. If these people put up with you and all the emotions that you throw at them in the process and are still there waiting for you at the end to come out of that cave that defines nursing school, well, these people are worth it. They recognize your sacrifices, even if they're the ones on the chopping block. They've been in the background, listening to your stories, helping you with your daily life, and waiting for your return. Please just turn around and face those who waited, supporting you throughout, and just give them a thank you. Thank you. This group in front of me came together on a cold morning last January in Innovation Hall, and everyone's linear life came together on and converged that day, and our lives were transformed forever. Each of us had made a conscious decision to choose nursing at GW over other professions. For 4 semesters, we dove headfirst into our coursework, only coming up for air once in a while, but we can all take a deep breath now. Amidst the reading, discussion boards, exams, papers, projects, clinicals, care plans, and countless sleepless nights, many of us have seemed like we've hibernated from all of you for this entire program. Despite the shift in priorities, though, our lives have marched onwards. 5 of us got engaged, 1 of us got married, and several of us welcomed new nieces and nephews. Some of us continue to work, volunteer, and raise families. Others lost loved ones, family members, friends, significant others. But we held each other up, and as close friends, we supported each other. And with the support of the top-notch faculty, we were able to push through with discipline and commitment to our own nursing training, even when it seemed impossible. But we did it. As nurses, much emphasis is placed on care, as it should be. But as nursing students, all we aim to do is help, in the beginning at least. Help your classmates, help your patients, help your nurse, doctor, specialist, nursing assistant, technician, service dog, anyone to make you feel useful. Helping is the catalyst to caring. As applicants, we had to prove we could help. And in the first few shifts of clinical, we were tested. I still vividly remember my first day of med-surg clinical. My classmate and I were assigned a fairly straightforward patient, and as we timidly began our assessments and conversation, she started to shift and shuffle in bed. We were nervous. When we asked her what was wrong, she said, "This medicine is making me feel like I have the chicken pox. Do you have a back scratcher here?" "Do you? Can you go find me one?" My friend and I looked at each other and said, "We'll be right back. We'll go check." I didn't know, as a new nursing student of 2 weeks, if her itchiness was an indication of an allergy, sepsis, crumpled bed sheets, MRSA, or a brewing pressure ulcer. But let me tell you, hospitals, though stocked with bandages and IV tubing and catheters, are not drugstores. They don't have back scratchers. And after we scoured the supply room and came up short, we knew we couldn't return to our itchy patient's room empty-handed. So we put those critical thinking skills to use, and 2 toothbrushes, a tongue depressor, a comb, and a whole lot of tape later, we had a back scratcher. And we helped. But other times, you'll feel completely helpless. On our second shift, we entered the unit, and then we heard an overwhelming wailing noise. After reports, a student finally asked what it was. The charge nurse explained to us that a woman battling cancer had just received word that her treatments had failed and that she was dying. Her way of grieving was to sob uncontrollably for all the world to hear, but no one could blame her. The nurse asked us if she could have some company that day, and my nursing instructor happily volunteered us. Right before we entered the room, the charge nurse pulled us aside and said, "This will be a hard day for you, but you'll learn a powerful lesson in nursing care. Can I give you some advice?" At that point, my partner and I were standing there frozen, saying, "Please just give us the answers or change your mind." First, never say you're sorry. Patients hear that all the time, and eventually they wonder if you mean it. It becomes disingenuous. Next, never ever say that you know how they feel, because you absolutely do not. Nobody does. And third, listen more than talk. Patients often just want to tell their story. Just let them, and you'll be fine. We walked into her room, and she stopped crying. Slowly, she began to speak about her life, her disease, and her family. We spent the whole day in and out of her room. When we were gone, we heard the wailing noise of her sobs throughout the hallways. When we were together, she would calm down and talk to us. Eventually, it seemed like we'd run out of things to talk about. After a few silent moments together, we asked if she'd like us to leave and give her some privacy. She shook her head and said, "I just want you here with me. It helps." Earlier that day, we feared we could do nothing for her. But here we were, having done something. We'd helped. Breakthroughs like this, watching life begin and end, and realizing our own contribution, occurred for many of us throughout clinicals, and the human experience has continued to challenge and amaze us. The students we were a year ago barely resemble the graduates we are today. Our abilities have exceeded our supporters' expectations, and we've even impressed ourselves, our harshest critics. The journey to this point has certainly not been easy. I know that I'm not the only one that wondered if I'd made the right decision or if I'd even make it to the end of the next semester. But as a class and as individuals, we have thrived. Nursing school has made us resilient, and now we can handle the most difficult of challenges that life will throw for us, at least in the beginning. But as we excitedly await and anticipate our future careers, there's one nagging problem that will haunt us all. This problem is called our inner saboteur. This term is used by Shirzad Karmeen, an executive coach and researcher in neuroscience and psychology, and a presenter at a TED Talk I attended this summer. Our inner saboteur makes us doubt choices we once felt confident about, and ultimately makes us question our competencies. Shemaine discussed how we begin our lives fully aware of how awesome and amazing we are, but have since forgotten due to the inner saboteurs that we create to deal with the chaos and confusion and hardships in life. They begin as defense mechanisms, but soon they become toxic, and as the name suggests, they sabotage our goals. They can be judgmental, victimizing, aggressive, controlling, and they make us want to give up. But these saboteurs can be quieted. Shemaine explained that we all have a contrasting voice termed the inner sage, which is the positive, accepting, and comforting voice. The inner sage reminds you that you're talented, brave, and one of a kind. As nurses, we use our inner sage with our patients, but we need to do the same with ourselves. Figuring out which voices we'll listen to can make or break our careers. Every time we leave a patient's room, we can either think we helped or we didn't help enough. Which will you listen to? So I say to my classmates, keep moving forward and keep helping. Help your patients and all those fortunate enough to have you in their lives. Soon your help will transform into care. Build up your inner sage, because ultimately, if we care and respect ourselves, we can be the best caregivers as nurses. Thank you.
I would like to invite Andrea Tennis up at this point, but what I would like to say is that that is probably just about the best student speech I have ever heard. That was remarkable.